Today marks 5 years since the World Health Organization declared COVID-19 a pandemic. Questions remain from the origins of the outbreak to the effectiveness of public health interventions. But chief amongst them is, are we any better prepared for the next pandemic? The human race is no stranger to infectious diseases. There have been around 250 pandemics or epidemics throughout recorded history. One of the deadliest ever, that's the bubonic plague, took place in the 14th century. Estimates say it led to the deaths of up to 200 million people, wiping out around half of Europe's population. Also called the Black Death, the plague is widely thought to have originated in rats and spread to humans via infected fleas. In 1918, an influenza pandemic swept the world, killing around 50 million people in the span of just 2 years. More commonly known as the Spanish flu, some estimates put its death toll as high as 100 million. Another notable outbreak of the past is the New World smallpox pandemic in 1520. The virus was brought to the Americas by the first Europeans arriving on its shores. An estimated 25 to 56 million people died. Smallpox has been completely eradicated since 1980 with the help of the world's first successful vaccine. It was also vaccines that played a vital role in preventing the further spread of COVID-19. Around 700 million people were affected globally, with the virus reaching every single continent. 7 million people lost their lives, but the actual death toll is thought to be higher than that. The WHO, though, says vaccinations reduced deaths by at least 57%. The threat of the pandemic accelerated the development of mRNA vaccines, such as the ones created by Moderna and Pfizer-BioNTech. This type of vaccine is new, but not unknown. Research into how mRNA could be used to fight disease began in the 1970s. Unlike traditional vaccines, mRNA vaccines do not contain any live virus. They help our bodies produce antibodies specific to the disease. Simply put, mRNA vaccines help trigger the same immune response that would take place in a natural infection, but without the risks of actual infection. The COVID-19 pandemic has highlighted the urgent need for swift and safe development of vaccines. But experts also say that even with vaccines, it may not be possible to prevent another pandemic.
Basically, the government struggle to combat, the misinformation, disinformation, that weakens public confidence in vaccines and response measures, and equally important, they weaken their trust, in public health agencies like US CDC. And so when the next pandemic or outbreak hits, that I think it will be an uphill battle for countries, the public health agencies to convince people to inject the vaccines.